Gastroesophageal reflux disease is quite common disease, and by this we mean in the lower end of the esophagus there is a sphincter. That means between the esophagus and the stomach there is a sphincter, and this sphincter is not working properly. So the link between the esophagus and stomach is open most of the time. So from the stomach there is reflux of food material into the esophagus. Basically the stomach is acidic, whereas esophagus cannot tolerate acid. So when the acid content of the stomach is refluxing into the esophagus gets damaged. That means the mucosa, the inner lining of the esophagus or the food tube, food pipe that we say, gets damaged. In course of time, gets inflamed, and ulcers may also set in. This is reflux disease, gastroesophageal reflux disease. The situations where we come across this is mostly in obese persons, during pregnancy, or sometimes because of some inherent defect of the lower esophageal sphincter, these situations may aggravate. Apart from this, there is a condition called hiatus hernia, where the sphincter is inherently lax. Then the acid will reflux into the esophagus and will cause the symptoms. These are the basic duration or basic condition where we get it. In addition, there are certain food and food products like citrus food, caffeine, theophylline, theobromine. Those things also can cause the further relaxation of the sphincter. Then aerated drinks like Coke and other Sprite, all these things, aerated drinks of any kind can cause this. So apart from these basic conditions, we have to avoid this, that we'll discuss during the treatment part. Gastroesophageal reflux disease, as the name suggests, there is a reflux of food and other content from stomach into the esophagus. Normally there is a sphincter at the lower end of the esophagus that we call in medical parlance lower esophageal sphincter. This is closed when we are not taking any food, and this opens up when we are taking food. So when this valve or this sphincter cannot close properly, is open, then food content from the stomach, that is a bag, food content from the stomach that refluxes into the esophagus, that is the food pipe. Normally the food pipe doesn't contain any food. When this lower esophageal sphincter is open, the content of the stomach refluxes into the esophagus or the food pipe, and this causes damage because the stomach is normally acidic, so all the contents of the stomach are acid, whereas the esophagus cannot tolerate acid normally. Because of the sphincter, the acid cannot travel upwards normally. But in this condition, the acidic content of the stomach refluxes into the esophagus and the inner lining mucosa. Initially it is inflamed, subsequently if it is not controlled, results in small ulcers. Ulcers go on healing, and then there is stricture, meaning thereby the narrowing of the lower end of the esophagus occurs. So these are the complications of gastroesophageal reflux disease. Apart from this, there are certain non-gastrointestinal complications of GERD or gastroesophageal reflux disease. Namely, the refluxate can travel up to the throat, causes epiglottitis, laryngitis, the voice will be gone, and then it can further travel into the lungs and can cause recurrent pneumonia, especially in children. And the oral cavity can also be spoiled decay of the teeth or erosion of the gums can also occur. So these are the non-gastrointestinal complications of GERD. Now, how do you diagnose this? The symptom itself is very much suggestive of GERD. It can be fairly diagnosed after taking a history from the patient. Apart from that, one has to do one investigation, namely upper gastrointestinal endoscopy, wherein an endoscope is put into the esophagus and the mucosa condition is seen. Further, the sphincter, lower esophageal sphincter, whether it is completely closing or not, that can also be checked during this procedure. After you diagnose gastroesophageal reflux disease, one has to give certain treatment. The first and foremost things are non-pharmacological things, namely there are certain food items, food materials like tea, coffee, chocolate, aerated drinks, fried food, spicy food. So these are the things, alcohol, tobacco, those things are to be avoided. This is the first and foremost thing. Apart from this, one should not mix up the liquid and solid component of the food together. That means soon after eating, one should not be taking liquids, that is water. There should be a clear gap of half an hour to quarter hour, 3/4. And soon after taking water, one cannot lie down horizontally. That will also cause aggravation of symptoms. So these are a few things. In very severe cases, the head end has to be raised for about 1 feet, then the feet end, to avoid travel of food from the stomach into the esophagus. And then we have certain medications. Basically, two types we use. One is a proton pump inhibitor that decreases the acidity of the content of the stomach, and number two is prokinetic, that means which facilitates the forward movement of the stomach content, so that once the stomach content passes away from the stomach into the further duodenum, there is no chance of refluxing into the esophagus. So these are the two main medication wherein we can control, whereby we can control the GERD symptoms. Apart from this, sometimes if the hernia, that is lower end of the esophagus, is open, that we call hiatus hernia, if it's too big, then surgery may be needed. And nowadays, laparoscopic methods are also employed and things are controlled. Once person is concerned about the early symptoms of GERD, can control them in time and can avoid the complications.